once we've made a decision and agreed with the patient to start Selexipag, what happens is that they would be undergoing what we call an up-titration. And by that, we mean that patients start on a very, very low dose and build up steadily over a number of weeks, which might be 8 to 12 weeks. And the reason for that building up slowly is because we know that the treatment is likely to cause some side effects, or can possibly cause side effects. So what we want to do is to build up the dose slowly. We normally have patients come to visit the centre. We provide them with some other medications which might be helpful in the event that they encounter some side effects. So the sort of side effects that we might expect might be headache or nausea or some general sort of tummy upset. And what happens in the same way with Selexipag as with intravenous drug is that that pathway, the prostanoid pathway, can cause these unfortunate side effects. And by pushing up the dose slowly, then those side effects can hopefully be managed. They might be encountered, they can hopefully be managed, and they hopefully won't cause people to need to stop the treatment. But it does mean that patients will be taking, they start on a low dose of 200 micrograms twice a day and build that up slowly. They'll have contact with their PH centre on likely to be a weekly basis during the course of that, just to make sure that patients are feeling okay, and if they are not feeling okay, they know exactly what to do about it and how to get help. So I think that's really important. And there'll come a point where they either get to the top dose that can be achieved, and then that's fantastic, or they get to the top dose for them that can be achieved, and that's equally fantastic. But what that means is that actually not everybody requires the same dose, and there isn't as such a target. What we're aiming for is the top dose that can be tolerated. So for some people that might be quite a low dose, and it might be quite a high dose, but it's the dose just one step down from where they're experiencing the side effects is the dose that they would then go on as their maintenance dose and in the longer term. And that's exactly the same as when we're titrating the intravenous therapy. It's obviously just that this is taking place at home rather than in a hospital bed. So nothing new and nothing different. But management of side effects and slow up titration of the dose is absolutely crucial. And you will, as patients, be getting regular contact with either the nurses or the pharmacy team at your local centre, your PH centre, to advise you throughout.